Frampton, who's the Insight Manager from Student Minds, and they're going to be presenting with us today on their research around university mental health, life in a pandemic. And they've also kindly provided a link, which I'll put in the chat, of the report that they've done, and the full document itself can be found in the link. So I'll send that. You might have had an email already, but it should be in the chat as well. So the floor is yours.
Well, thank you. Nicola, did you want to do the presenting, or do you want me to?
I will give it a whirl, seeing as your laptop does not.
Thank you. Ace, well, hello everyone. Really glad to be with you. Always a joy to be doing stuff with the SMaRteN network. Just as a quick little sense check at the beginning, who has engaged with Student Minds in some way or another before? Just who's familiar with us, who isn't? This is where we get to use the show of hands function in a different way. Very different to seeing an audience, but I'm making do. Ace, lovely. About half of you, a third, which means half of you are completely new to us, which is always nice. Welcome. I hope you enjoy this session to come. So if you're all right to move us on, Nicola. So for this, we're going to give a little bit of an overview into who we are, who Student Minds is, just very briefly for those of you who don't know us, before we go into talking about the context behind the report, some of the main headlines we've found, and also broadly just give a space to talk about some of our reflections and learnings of the practicalities of doing research as a charity, some of the failings, hoping to use this as a reassuring and inspirational space to normalize lots of failures and challenges in doing research work, because we don't get it right all of the time. We go through lots of barriers. So hopefully it'll be a useful discussion just for you to get a sense of how research is done in a charity context. So if you can move me on, Nicola. So briefly, hi, hello, I'm Dom Smithies. You see him pronouns. I'm Student Voice and Equality Lead at Student Minds. So broadly overseeing all of our programs, projects and policy work where health inequalities comes into play. So that's understanding the different experiences of particular student communities. Nicola, if you want to say a very quick hello of what your job is.
Yeah, hi everyone. I'm Nicola Frampton. I use she, her pronouns. I'm the Insight Manager at Student Minds. I basically lead on Student Minds like listening work, so commissioning and conducting research, producing insight briefings for our team, just to make sure that everyone's informed of the latest kind of student voice issues, how students are feeling, and what's going on in university communities. So that's kind of my role.
Cool, nice. So to move us on to who is Student Minds, what do we do? I'll try to keep this brief and just mention the headlines of lots of our work and leave it to all of you to go and research and find out more if anything piques your interest in any way. So who are Student Minds and what have we achieved? So we currently run a program called Student Space, which is an online support platform for students designed to support them through the pandemic. And it brings together a directory of services so students know where they can get support, particularly while accessing things digitally. We have a number of specialist services. So we work with a number of other organisations to cater for communities we recognise for being more significantly impacted by the pandemic. So we've funded a number of work with organisations like Black People Talk, Mermaids, Reclaim, to make sure we're supporting specific student communities, as well as working with the Shout and the Mix to make sure we've got generalist services available to support all students. We have a number of sector-wide programmes to kind of be developing and improving institutions' practice, policies and strategies when it comes to student mental health. So we've got the University Mental Health Charter, which involved developing a huge framework and collating a lot of evidence to make sure we've set out some principles of good practice. And we're currently in the process of launching and having our first year of over 40 institutions going through the awarding and assessment process for that. And we also have a program for students' unions, so looking internally as institutions within themselves of how they can be better supporting students, prioritising student mental health in their work. And then we also have a number of training programs where often our model is a train the trainer approach, where we train up university staff members and student union staff members to deliver training workshops to students that covers lots of the tips around how to look after yourself, look after your peers, access support and such. As you will have picked up from Nicola's existence, we do lots of insight work within the team just to make sure we're keeping our ear to the ground. We're very mindful that as a national charity, it can be a challenge to know what's going on for students in the everyday, especially as there can be vastly different experiences being had by students at different institutions. So Nicola does a fab job to make sure we're trying to keep on top of what's happening with students, what's going on, trying to work with Jenny, our policy manager, to predict the issues that are going to be coming in the future as well, to try and anticipate where we might need to be supporting students in the future. And then we do a number of projects that have been funded by OFS, Comic Relief, and other funders, where we've done things like developing podcasts, doing lots of co-production projects to support international students, improve access to NHS services through improving pathways, and recognising how curriculum and pedagogy interacts with mental health and how good curriculum design can be done with mental health in mind. Lots of other stuff as well. This list is non-exhaustive, but I hope it gives you a flavour of the kind of things we're working on, some of our flagship programmes, and if any of that is interesting to you, do just go to our website to check out a little bit more. We were asked to briefly just touch upon how we talk about mental health and how we define it, and particularly how we talk about it in a way that resonates with students and is consistent with the sector and academic work in terms of researching and measures. And to be honest, we use a few different models and different language and terminology in different contexts. Probably our most routine is the keys one, which is a way of looking at mental health and well-being kind of on an intersection and seeing as it's something that's more fluid, where on the day-to-day individuals can move around. So if you see mental health difficulties, it's kind of having a diagnosis or an illness as alternative words, and well-being being more around how you're feeling, your everyday mood. And it also is a tool that we like to see that you can recognise that people can have a diagnosis, can have an illness, but they can have the support in place, the treatment in place, the medication if they need it, to be managing that completely well, be fully functioning and thriving, and have really optimal well-being. But also recognising that you can have people who have no diagnosis, no illness whatsoever, but just the everyday stress of assessments or challenging relationships or going through bereavement can have a real toll on their mental health, and they can be really struggling and not functioning optimally. So it helps to give a little bit more of a fluid framework by which people can move around. So that's the one we probably use more common. We tend to avoid the pyramid on the right by Kutcher, generally just because pyramids can often create hierarchy and present a sense of things being static. No, that's not the intention of this pyramid. The pyramid is more to give a sense of the scale and the proportion of how many people are at what different level generally. So it's useful to kind of paint that immediate picture of the proportionality across populations. And then if you are keen to get particular definitions and terminology that we use, all of that is outlined in our University Mental Health Charter Framework. So I've mentioned it there. Do have a look if you're ever struggling for definitions and are looking for people to follow. Feel free to use ours. But I've also included the World Health Organization there for context if that's interesting too. But if you can move us on, Nicola. was also asked to touch upon the challenge of recognizing that students aren't a homogenous population, and in a lot of our work we take an intersectional approach. We try to look through everything in an intersectional lens, which for us means that we're being mindful of the different communities that students belong to, different identities that they will have that will intersect and interrelate with their mental health, and will kind of explain or help us understand the different challenges they might face, the different risk factors they might have, but also the protective factors too. There's a lot of research that is done on, I suppose, all these individual communities and how that interrelates to mental health, and then layering that on top of the experience of students and young people and overlapping that with other identities too is a piece of work that we try to do all the time, just making sure we are mindful. We have done a number of projects where we do look at specific student communities at a time just to deepen our understanding of them. And I know in our research and listening, Nicola often does filter out to make sure we have demographic specific briefings, so we can kind of compare and contrast different student communities' responses in lots of our surveys and research to try and get that understanding. But broadly, we are very mindful that we need to be careful not to group students into one pot all the time, as it can often be the case that particular student communities might be skewing data or going through something significant that doesn't affect the whole population. So diving deeper in sometimes helps provide more clarity, if that makes sense. Very brief on that, sorry, happy to talk about that more, but conscious we don't have a lot of time to run through a lot of stuff. And then just to flag a lot of the general, widely recognised kind of main headline challenges to student mental health, I thought it would just be useful to have listed here. We know it is a challenging time of transition for students when they go into university. They are becoming independent, most of them for the first time, and that is a challenge as they learn to adjust with all the new responsibilities, the new city, new relationships they have to find, new ways of learning, studying, and being assessed. And it can be a challenge for lots of them. I suppose it's also important to recognise that also largely for ages under 18 and under 25, this overlaps with the age of onset for mental health difficulties developing. So for under 18, about 50% of illnesses will have developed by that point, and by 25, about 75%. So it's a real significant period where the development and onset of mental health difficulties will be emerging. So it's important to keep that in mind with the student populations too. That's me briefly running through everything. Sorry that was a bit of a whirlwind, but happy to go into more detail when we get over to the questions and answers. But over to Nicola now.
Amazing. Thank you, Dom. I think you managed to do that whole section without mentioning pandemic. And now I'm going to talk about specifically just the pandemic. So as was mentioned at the start, Dom and I have written a report recently about our research about students' experiences during the pandemic. So just a bit of a skip to the findings of that report, basically, and how we went about doing it.
Nicola, sorry, I think you might have hit the mute button while you were moving slides.
Oh no. What was the last thing I said?
It was just as you switched slides.
I switched slides. Okay,
yeah, we got the first
Sorry,
bit.
I'll move my mouse. Cool. So background. So obviously the pandemic kind of kicked off in the UK back in March 2020. Slight disclaimer, I didn't actually work at Student Minds at that point in time. So if anyone has specific questions around what Student Minds actually did, Dom will be around to answer those questions. But Student Minds made the decision to prioritise listening work during that period of time. So kind of hit pause on a lot of the very active things that were going on pre-pandemic, and decided to just dedicate a lot of time, effort and resource to just hear what students were saying, what was being said about students, what was going on in universities across the country, and all of this kind of listening work in the end across from March until about February this year led to an analysis of around 2,000 sources, and that was news articles, social media posts, individual accounts from our networks, so our student advisory committee, the universities that we were working with in the charter, as well as secondary research findings which were coming out across the sector as well. And then between April and June 2020, Student Minds also conducted 2 pulse surveys for both staff and students to share their experiences with us. So they were very broad surveys just to really build a picture of what was going on for university staff and students during this period of time, what the challenges were, what support students were needing, what was maybe not being provided by universities during these times. And that did allow us to build quite a good image of what students and staff were experiencing and what they were needing from us, I suppose. And then fast forward slightly, so kind of our broader listening work continued during this time. And then in April, May this year, we conducted a survey of around 1,000 students and opened a call for evidence. And then we pulled all of this together, which was quite a feat, in our report, the University Mental Health Life in a Pandemic report. So everything that we'd kind of learned, reflected upon, found through our own research, we kind of pulled into the themes from the University Mental Health Charter, which Dom's already spoken about, which were live, learn, work and support. And we kind of broke down our findings and our learnings into those themes, which made the report. And then since then, we've conducted a second survey in September and October. So we have included the findings of that second survey in this presentation, even though that's not in the report. So I'll come on to that. I muted myself again. Whoopsie. So headline findings from the, this is this year's. Headline findings from May 2021. So this is the first round of research that we did, which fed into the Life in the Pandemic report. And there's a lot more findings within the report itself. These are just the headline findings. So we found that 74% of students reported that COVID-19 had had a negative impact on their mental health and well-being. 49% said their financial situation had been negatively impacted. 2/3 said they had felt lonely or isolated often since March 2020, so since the start of the pandemic in the UK. 82% felt that the COVID-19 pandemic had negatively impacted their academic experience, and 65% of respondents said they needed additional help or advice during the pandemic, but of these, just 19% actually got this help. So really what we found was that COVID-19 had impacted every aspect of students' lives across their whole sort of experience, both at university and both sort of at home outside of their student life. And we really wanted the report to highlight this. So which is why we split it up into the themes that we did. And then our second round of research, which I spoke about, we ran just back in October this year, sort of just around the start of the new academic year. We were sort of looking ahead to what students were worried about, going back into university, sort of post-pandemic, but not really post-pandemic. We found that broadly mental health and wellbeing seems to have improved slightly since the first round of research that we did. But 63% still felt the pandemic had negative impacts on their mental health over the past month. So really through September, it was still having this negative impact. We found that 53% of respondents said they were experiencing a current mental health issue. But just a slight warning here, we do suspect we have a self-selection bias in our sample. So we think students who have experience of mental health issues perhaps were more likely to complete a survey about mental health in the first place, which might have skewed our findings here slightly. We found that 2/3 of students with experience of mental health issues hadn't disclosed this to the university, so clearly a barrier here to students actually accessing the support that they need at university because they haven't disclosed it, and of course there are lots of reasons why that may be. And then we also found that 26% of students expected the start of the academic year to have a negative impact on their mental health. So kind of as Dom, I think, highlighted earlier on, there are lots of ways that students' mental health can be impacted by either returning to uni or starting to uni. And lots of students kind of expected their mental health to take a bit of a hit at the start of the year. So it'll be interesting to see kind of if that continues as we continue our listening work, or whether it was kind of an initial shock to the system and then things improve. And then finally, 67% said they were worried about their mental health for the 2021-2022 academic year. So it's obviously clearly a thing that students are worried about, they're concerned about, and it's kind of on their radar as something they might need support for throughout the academic year. So that's kind of what we found in our own primary research. And as I said, there's a lot more throughout the whole report. So would encourage you to check it out with the link that's been provided, and do feel free to follow up with any questions once you've had a look at the whole report. But we just wanted to share some reflections and some learnings from actually doing the research from the perspective of us being a charity and of course a pandemic going on at the same time. So we did find the balance between sharing the insights and information that supports our organisational aims and objectives, and like sharing with the communities that we thought would benefit from our learnings. Balancing that with producing research that's of an academic standard was tough. We obviously wanted to be sure that we were rigorous in what we were doing, but also timely and useful. And kind of balancing getting stuff out there that's valuable for the sector, but also that's reliable and evidence-based kind of suggestions for the sector. We had opportunities to collaborate both internally within our own team, but also externally with, we brought in writers for sections specifically about the Black Lives Matter movement and women's safety. We brought in Altline to actually conduct the survey on our behalf. So we kind of recognised the point where we didn't necessarily have the expertise or the time or the capacity or whatever it might have been. And we kind of knew when to bring other people in and get feedback or additional contributions, which was particularly helpful for our report. We had interesting conversations when we decided to start this piece of work. As I said at the start, there was an analysis of about 2,000 sources. We had so much information, so much insight. The Student Minds team had collected so much before I'd started in my role that it was difficult to know what we were doing and what to share and what to write about and what would be helpful. Where our boundaries were. We made the decision to talk about things that might not have on the surface seemed to have related to student mental health, but actually we knew that things like housing and finances did have clear impacts on students' mental health. So we decided we did want to write about those. But it was a lot to work through, a lot to get our heads around and decide what our boundaries were, what we were going to do. And yeah, it says we don't get overwhelmed, but there were times where it was quite overwhelming, and we knew that we needed to kind of put those boundaries in place to stop us from being overwhelmed in the future. And yeah, lots of flops and failures. It was tough. We had shifting timelines. The pandemic was unpredictable. We had so much literature to draw on, so much to include. It was tough to know what to put in, what not to put in. We had to recruit for survey respondents, focus group participants. Our call for evidence didn't get as many responses as we would have liked. And yeah, it was tough. So yeah, we just wanted to be real with you and say there was lots behind the scenes that you would not necessarily know looking at the report, but lots of challenges, which we're happy to share on how we kind of overcame those as well, if you have any questions. And that's it. Dom.
Nicola, can I, well, actually, just building back on the previous slide, sorry to throw in a couple of ad-lib extra thoughts, but I feel like you touched upon it before just when you were talking, particularly with that first point, and the challenge we often face whenever we do our research is self-selection bias, just from being a mental health charity, having an audience and a network that is passionate about mental health, largely people who have experiences of mental health difficulties, being able to do our own research that is going to be recognised as accurately representative of the general population rather than self-selective is a constant challenge, and is part of the reason we were wanting to do more robust research, do seek to collaborate with externals, bring in other partners like Autoline to help manage that. So I think that's yeah, you touched upon it earlier, but just recognizing that is a real challenge for us to navigate sometimes.
Yeah.
And there was another thought, and now I'm worried I've forgotten. Oh, in terms of the scope and the purpose. So with the pandemic in particular, one particular example that I remember coming to mind was we said we wouldn't put anything in the report, write about anything that hadn't come through our listening already. We wouldn't seek out new information. And something we did pick up on the end, something we wanted to write about but felt we didn't have enough sources or information from students and university staff, was the impact the pandemic had had on the NHS, and then the impact that had on the NHS being able to support students. We wanted to go away and do more research on that and find out that, as we did recognise that was a bit of a gap. But in staying true to our original scope and purpose and the timelines we had to work with, we weren't able to. So to give an example, there's often things we know are widely going to be felt to be valuable and important, but you do have to stick to your original scope and purpose just to keep you to time, just to give an example of that.
Yeah, that is a good example. Great.
Thanks.
That is everything in terms of our presentation. So I will stop sharing and come back, hopefully see you guys again, and we'll take any questions, have a bit of a discussion.
Thank you very much, Dom. Thanks, Nicola. That's fantastic.